Assalamu alaikum. Welcome to the Medicos channel. Today we will learn some basic about thoracic case. This is thoracic case. It is also known as rib case, and this is the osteocartilaginous structure that encloses the thorax. We can see it is formed by 12 thoracic vertebrae, 12 pairs of ribs and associated costal cartilage and the sternum. The anatomical space between two ribs is called intercostal space. The main function of the thoracic case is to support the thorax and protect the vital structures within it, that is heart, lung, aorta and others. In addition, the rigid structure of the case allows to be an attachment point for many muscles of the upper body and to support the weight of the upper limbs. It is divided into one median and two lateral compartments. Here, the anterior aspect of the thoracic case and the posterior aspect of the thoracic case, and finally, the lateral aspect of the thoracic case. Anteriorly, the thoracic case is formed by sternum. Posteriorly, it is formed by 12 thoracic vertebrae intervening intervertebral discs. Laterally, it is formed by 12 pairs of ribs and associated costal cartilages on each side. Now we will talk about sternum. It is formed along the midline of the thoracic case. It is also called breastbone. It has anterior and posterior surfaces and lateral borders. It consists of three parts, that is manubrium, body and xiphoid process. Here the costal cartilages, it is from the anterior continuations of the ribs. It is composed of hyaline cartilage that is extends from the anterior ends of the ribs to the lateral surface of the sternum. The thoracic vertebrae are one of the 5 regional groups of the vertebral column. They are found along the posterior aspect of the thorax and located between the cervical and lumbar vertebrae. The ribs are one of the 2 groups of bones of the thoracic case, the other being the sternum. Here, the first 7 ribs, these are true ribs. From 8th to 10th ribs are called false ribs. Here, 11th and 12th ribs are called floating ribs. The first, 2nd, 10th, 11th and 12th ribs are atypical because they have modified structure due to their function and position, and other ribs are classified into typical. Now we can see here, posteriorly all the ribs are articulated with thoracic vertebra. Anteriorly, the upper 1st to 7th ribs articulate with the side of sternum through their costal cartilages. Here, the white portion is costal cartilage, and the next 3 ribs, that is 8th, 9th and 10th, articulate with each other through costal cartilages. Again, the lower 2 ribs, that is 11th and 12th, do not articulate with any rib, and the anterior ends of their costal cartilages are free. The thoracic case is flexible framework of bones and cartilage. It is conical in shape. It is narrower at the top and broadened to fit and protect some critical organs, that is heart and lung. The median compartment is called main sternum, occupied by heart, and 2 lateral compartments are occupied by lungs. Here the cross-section of thorax, it looks like kidney shaped, but in case of infant it is circular. Ribs are obliquely placed. Transverse diameter can be increased by thoracic breathing. Thanks for watching and please don't forget to subscribe.